December 1st, the CDC is tracking 76 measles cases across the entire United States. Central Ohio accounts for most of those cases. As of today, there are 58 cases locally, all involving children. A local family doctor says she's worried about the outbreak and what it means for adults. NBC4's Karina Chung joins us now live to explain that. Karina?
Jared, Dr. Barbara Bauer is a family physician out of Ohio State Primary Care Westerville. She says measles is something a lot of people have never dealt with. Columbus Public Health and the CDC are still working to pinpoint how Central Ohio's measles outbreak came to be. CPH is investigating 58 cases, all involving children. In 3 of the cases, the child was partially vaccinated.
Measles was essentially eradicated for a very long time, and I think that the concern is that a lot of the people now have no idea how severe this illness could be.
Dr. Barbara Bauer, a family physician with Ohio State Primary Care Westerville, says many often think of this as a childhood disease.
Even adults who don't have immunity or never vaccinated, I mean, they could have a lot of complications and sometimes even more serious illness than children.
Dr. Bauer says adults and children will have symptoms like runny nose, fever, cough, and the rash if they're sick with measles. She says adults can have more severe complications like lung infection or altered mental status. Bauer says some people, specifically older people, even though they are vaccinated for measles, could experience waning immunity.
You know, even the CDC is recommending, if you're not sure if you had both doses or if you're immunocompromised, you're older and have a lot of medical problems, there's no harm in getting actually almost like a MMR booster, or you can also ask your doctor to check whether you do still have immunity, and if you don't or it seems to be lower, to get a vaccine again.
Columbus Public Health is warning Central Ohio residents about 4 public places for possible measles exposure. Bauer says adults who are sick should take note and stay home.
With kids, they have a fever, we keep them home, right? Daycares don't accept them, they tell them to stay home. So it's almost like we can quarantine kids better than we can adults.
I did reach out to the CDC today to see if it would discuss the outbreak here in Central Ohio. I did not get a response back. Now, Columbus Public Health says a team with the CDC is helping with that investigation, and they've been here for about a week. Local for you in Columbus, I'm Karina Chung, NBC4.
Karina.